There is a lot of misinformation out there as it relates to what is normal for our bladder to do or not do. My name is Dr. Brooke Classic, and I am a pelvic physical therapist who is passionate about helping people understand their bladder and pelvic health. And today I am going to be debunking the 6 most common myths that we hear about your bladder. Bladder myth number 1, it's normal to go to the bathroom all the time. False. Although it's common for many people, especially women as they get older, to feel like they need to go to the bathroom more and more frequently, this is a sign of dysfunction. A typical normal filling bladder should be able to hold urine for anywhere between 2 to 4 hours, which means in a 24-hour period, we should only be going to the bathroom 5 to 8 times. If you're going more than that, that could be a sign that there's some type of dysfunction that we should deal with. Bladder myth number 2. Everyone needs to consume 8 8-ounce glasses of water a day to maintain hydration. This is absolutely false. Now, we want you to stay properly hydrated, but 8 8-ounce glasses does not work for everyone. This is an individualized recommendation. What we usually tell people here is to go by the color of your pee. When we first get up in the morning, that first pee should be a brighter yellow, and then the rest of our pees throughout the day should be a pale yellow. If we are having pees happen throughout the day that are a bright or a dark yellow, that means we need to take in more water. And if we're peeing clear, that means you can take in less water because it's just going through you. So no, it is false. Everyone does not need to consume 8 8-ounce glasses of water to be properly hydrated. Bladder myth number 3. Holding your bladder because you don't want to use a public restroom is perfectly fine. Now, occasionally holding, if we can't get to a restroom in time because there isn't one nearby, is okay. But if you are repetitively doing long holds of the bladder, say for over that 5 to 6 hour range, and we're doing that over and over again, that puts a lot of stress and strain on the bladder, which in turn can lead to issues like urgency, frequency, and potentially urinary retention and even urinary tract infections. So I get it. There's certain bathrooms that you may not want to use, but we are designed to void every 2 to 4 hours. And if we do that prolonged holding, that can cause problems down the road, especially if we're doing that day after day. Bladder myth number 4. Alcohol and caffeine are fine in moderation. Now, for our bladder, that simply may not be the case. Some people are very affected by these bladder irritants of caffeine and alcohol. And so if you're experiencing urinary symptoms such as leakage, urgency, or frequency, you might want to experiment with limiting or completely eliminating alcohol and caffeine to see how your bladder responds. Bladder myth number 5. Overactive bladder is a normal part of aging. Again, not true. It may be common, but it is not normal. Overactive bladder is a medical condition where our bladder starts sending us the signals that it has to go more and more frequently throughout the day. So we can end up with urinary urgency, frequency, and leakage. This is a sign that something is going on, and we need to make a change to help the symptoms go away. The good news is that partnering with a pelvic physical therapist and certain lifestyle changes can make a huge difference to help you get back into control of overactive bladder. So if you are experiencing these symptoms of urgency, frequency, and or leakage, it is not something that you're stuck with, and there's something you can do to get back in control. Bladder myth number 6. Kegels are the only thing available to help with pelvic and bladder issues. For this one, I had to get out my trusty pelvic model to show you our pelvic floor. So anything in the red area here is pelvic floor muscles. And when these guys contract, they lift up and into the body, and that is more commonly known as a Kegel exercise. And for many, many people, all they've ever been told if they're dealing with any type of bladder issues is to just do Kegel exercises. And I'm here to tell you that that is simply bad advice, because without assessing what's going on in the pelvic region and just blanketly telling people to squeeze their pelvic floor muscles, we are doing a complete disservice because we don't actually know what's going on. If these muscles are in fact too weak, the person may not be able to correctly contract them and may need help figuring out how to do that, because many people actually do this contraction wrong. On the flip side, these muscles might actually be too tight and they're causing some of the pelvic and bladder issues like urgency, frequency, and leakage. And if we tell someone who's got a tight, tense pelvic floor to just contract the muscle, that's actually going to cause more of a problem. So that blanket advice of you have bladder issues, just do Kegel exercises, simply doesn't work. It is not a good fit for the vast majority of people. So there you have it. Those are the 6 most common bladder health myths that we hear here at our practice. Which one surprised you the most? Many people are surprised to know that alcohol and caffeine are really a no-go for their bladder, especially if they're dealing with urgency and frequency. Or other people have been surprised that their increased urgency, frequency, and leakage as they get older is maybe common, but it's not normal. So we hope that these myths maybe surprised you as well and enlightened you about some common things that can go wrong with the bladder, but that aren't a normal part of the aging process. If you're experiencing any of the bladder issues that we just talked about, we highly recommend partnering with a pelvic physical therapist to get to the root cause of what's going on with your bladder health. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.